Good evening, Lenny.
Are you okay, darling?
Yes, I am. I'm ready. Thanks.
Give me 2 seconds. Beautiful voice, of course. I gotta tell you. Well, Stephanie Mills, one of our favorite artists. And of course, that rousing voice of the great man himself, the late Leonard. It's all about Luton Urban Radio. I've got to say, joining us shortly this week. We can tell you, I love technology right now. Trying to get through. And we have the pleasure. We have the pleasure of the young lady on the other line. Good evening, Doctor.
Good evening, Lenny. How are you?
Oh, you sound good. I'm very well. It's so good to hear. Because me with technology, we just don't agree. But we are trying, because we wanted to do this thing on a streamline, but somehow it's not getting through. But however, it's good to have your voice on the other line. Welcome. It's been a while, but welcome to the program.
Thank you, Lenny. Yes, it has been a while, but I'm always very grateful for the opportunity to be on your show and obviously listening to some amazing music as well.
Well, I've got to say greetings to your family, your friends, and so on. And tell us, since we last spoke, so much has happened, really. But before we introduce you to our listeners, in fact, that would be the best thing to do. Before we introduce you, because you have such a wonderful, wonderful history here. And what have you been up to since we last spoke? With that COVID, now we're talking about Russia, now possibilities of World War III, my dear. So many things happening. What have you been up to?
Well, I've just been like everyone else, just living with COVID, and that's why the government's announcement, has been obviously welcomed by a lot of people, because I think since December 2019, when we first heard about COVID-19 from Wuhan, China, and then we started to have lockdown in the UK in March 2020. And later on again in the year and earlier this year. So we obviously, everyone's just living with COVID. And so the government's decision, Boris Johnson announced in Downing Street yesterday that it was the end of the domestic restrictions. So if anyone tested positive for COVID-19, they did not need to self-isolate.
Okay. Now, of course, we just done that introduction. Let's give our listeners, let's introduce them and tell them who you are. If you can briefly tell us, because there's so much things you've done, and I've got to say, it's been a pleasure. It's a pleasure really having you on the show. Tell us about who Dr Seshni Moodliar is.
So I'm going to keep it brief. I'm a consultant psychiatrist, but I specialize with adults with learning disability. I'm currently working in the private sector, and I'm also an author. I am an author of Pass the Cass book and 2 other books on social media and on interview skills. So I teach psychiatrists and professionals globally for the exams, for the Royal College exams of psychiatry. And I'm also involved, because I'm so passionate about cooking and because of my rich upbringing in South Africa with my parents. I had a spice shop, both my parents are late, but I grew up in a spice shop. So that obviously influenced me, to combine my medical knowledge with my passion for food and cooking.
I'm really so glad you touched that bit of cooking and food. Lenny loves a bit of food and cooking as well. We will indulge into that later on, because I've been following you, watching all the recipes and the spice station and so on. I'm thinking, looks sumptuous. I just wish I was your neighbor next door. Trust me. My mom, I remember my mom growing up, my mom used to hate the idea that there was dustbins and things thrown away.
I can imagine.
So with Lenny T next to you, definitely there will be no waste at all, my love. You'll go into what we call the good old tummy.
Well, the next time I come in, I did bring you food the last time.
Yes, you did. It's been a while. That's what I say. It's been a while, and we look forward. Next time we do that, we have to video that proper with a great man, of course, Leonard, doing his cooking theatrics on the other side. Now, so tell us now, COVID, this is it over? Because they're not really talking too much about it on the news or radio. It's died. It's there. You've got to look it up. What's the latest on COVID right now and the restrictions?
That's really interesting. That's interesting that you've picked that up. So, yes, they haven't really said much. They've just made this announcement that the COVID restrictions, if someone tests positive, ends. So that's the latest from Boris Johnson. They've also announced that free testing from the 1st of April will no longer be available, and people will have to pay for tests, for lateral flow tests and for PCRs, and also, but I think Boris Johnson has announced that you can get a test for at least £2.50 from Boots. I think that's the latest that I've heard on the testing. So in terms of whether COVID it has gone or not, I don't think so. So we're not hearing. So I think there was some criticism over the decision from Prof. Sridhar. She's wanting to know where's the evidence that obviously the government has made this decision, So I think there's mixed feelings around it. A lot of people are quite happy and, moving on with the title which they've made it, living with COVID. And
explain to us, how did this come about, living with COVID? Because I'm saying I personally could have COVID and I truly have COVID, so am I supposed to just accept that and welcome that title? Well, surely, that sounds pathetic, that title, living with COVID.
Well, to be honest, I think I'm not, in terms of living with COVID, I think the way I understood it to be was that we're living with COVID in terms of the pandemic. So it's we are living still, we are going to acknowledge that COVID is still around. So what the scientists are saying, you were asking about what are the scientists saying, we are not going to get 100% eradication of the virus. What they're predicting is the numbers definitely will go down. We've had about 25,000 positive cases. I'll get the actual figures in the last 24 hours, but over the last 48, 72 hours, that's been the reality. We've had positive cases, and that's gone significantly down from being in the 200, 150,000, 50,000. So it's gone down. Total number of deaths have gone down as well. So the scientists are predicting that the numbers will definitely go down. However, we will not see it be eradicated totally. So up until June, we still need to bear in mind that COVID will be around. So I think this is what they mean by living with COVID. So that's my understanding, Lenny. And also, sorry, can I just say that, so living with COVID is obviously a term that we all will have to get used to. Basically we have been living with COVID in terms of the way we've had to adjust our lifestyles. So I think it's about also some positivity assigned to it in terms of just restoring our lives to going back to the normal, the way we knew it pre-COVID. So I think what that term says is that we have to live with COVID, but we're trying to basically get back to our normal lives, back to before December 2019, when things changed for all of us.
Indeed. Hey, here's the question. Of course, there are many stipulations, many questions to be asked and answered as well. When the government says COVID tests will no longer be free for most people, I know when you're giving like these free lateral flow tests, I should have collected many, really, because now it's telling me we're going to have to pay. That's not fair, surely. A country such as this, you'd think that, they would look after people who can't afford to pay for this test.
Well, Lenny, I totally 100% agree with you. In terms of lateral flow tests, my advice is, obviously, this is what the government is saying. And I think from what I've heard, a lot of people have the same sentiments as what you said. I've seen a post on Twitter from Sadiq Khan, the mayor of London, and he's urging the government decision to change. So I think a lot of people feel exactly the way we feel. let's see what happens in the next week or so as to what they are going to decide, whether it might become free again from the 1st of April, or if Boris Johnson will continue to say that we would have to pay for lateral flow tests. And I totally agree with you. We've been having it for free, and I get it for free at work. The kids get it for free from school. So it's going to impact if we have to pay for it. And I think this is what the whole country is saying. So it's not just you, Lenny. It's everyone else is saying the same thing. So let's see what happens. But the cheaper option is Boots, which Boris Johnson is promoting at £2.50, which is still, I mean, how are people going to be able to afford that? You know, some people might not be able to.
Here's a question, of course, in your practice, in your kind of work. We've noticed, of course, a lot of people who were affected with COVID. Some have recovered, some have lost their loved ones as such. But the mental strain that it may bring upon a family, and especially in the industry that you work in, what sort of people have you come across, and how have you given them the strength or the courage to keep hope alive, really, and be positive?
Yes, I think unfortunately we're nearing up to 6 million on the Worldometer in terms of people that have died from COVID-19. And as you know, every life matters. Going through grief and losing a loved one through COVID is obviously something which a lot of people, so up to 6 million people, have experienced it. I myself had gone through bereavement in May 2020 when my mom passed away soon after we started with the COVID-19. So I myself was going through the grief. So I think in terms of the grief process, as I openly said, you know, even for me as a psychiatrist, I think for any person going through grief, it's not easy. We need to acknowledge that. It's really a difficult and challenging time losing a loved one, you know, whether they're a friend, a colleague, you know, your partner, family member, you know, someone that you know of, someone in the media. It's really difficult, and we're hearing more and more about people dying. So I think a lot of people have, it's been sort of like cathartic because we were all going through similar processes at the same time. The grief process in itself, Lenny, as I've discussed before, is divided into different stages. So you have the denial, the anger, the bargaining, the depression, and then the acceptance. So even for myself, and I recommend to any person going through grief, is go through all those stages. Don't try and skip one stage, because if you try to, for example, some people might just try to adjust to losing a loved one and just carry on as if life is just, you know, like the same one and normal. You can't simply do that. You have to deal with the emotions of the loss. So you need to go through the denial, the anger, the bargaining, the depression, and then the acceptance phases. And it can take anything from a few weeks to months to get through this. And I think what has helped and what I would advise people is get support, talk about it openly. If you need further help, speak to, you know, people around you, speak to a healthcare professional, speak to your GP. Also, draw on the support from friends and family. You know, if they're willing to help you during those early days when you lose a loved one. Because during the first few days and weeks, you know, some people, you know, they feel like it's like such a loss and it's such a tragedy to lose someone. You know, they become quite sad, tearful, and it feels like a heartache, you know, like someone's, you know, taken something from you. So it's really quite emotional, and it's a situation you need all the support you can get. So if anyone's offering you support, like, you know, offering you time and messages and, you know, and also offering you, you know, some meals, you know, all these are really welcomed. You know, I certainly know.
In your case, when we spoke obviously about mom, how did you manage to go, or the experience you had? If you can briefly share with us, how did you, and who was it that supported you in order to give you that more empathy, that more comfort, that bringing you to where you are right now.
Yes, yes, I remember that time. And Lenny, you were also part of that support, giving me the opportunity to talk about it and go through it. I was so fortunate because even though I was in the UK and this happened, my mom passed away in South Africa through sad, tragic circumstances, I was able to have so much of support. I'm not exaggerating, but I'm sure if you've seen my Facebook and my social media posts, I had hundreds of messages, up to thousands of messages of condolences when I first put the post up. So I think some people might want to keep it private, and I understand that. But for me, I wanted people to know what I was going through. And also, for me, I felt there were so many people, because my mom was a teacher, a very well-known teacher in South Africa, and she had so many students that adored and loved her. And I went to the same school as her. All of us did. So everyone was grieving. So it wasn't just me. So just drawing on that with the support from everyone. We had support locally, support in South Africa, support from India and globally. So it was so amazing that I had so much of messages of support, and that really got me through. We had people offering, calling me up, leaving messages, even though at the time I couldn't respond to every single message. I made a point to thank each and every person afterwards, or get back to the messages. The other things, Lenny, as I said, people offering support, like offering meals, that really helped me. Even though I was someone that loved cooking, and I still love cooking, I'm always in the kitchen, cooking up some tasty food like my mum did. But at that time, it was really challenging. So we had people, friends, just dropping food off, dropping cards, delivering cards and flowers, and all of that. Just
these are those important things that can build one confident and self-esteem as well, especially when you're on the lower stature.
Yes.
We talk about this thing, as you said, people like to keep certain things private as such. But of course, you're in a profession now, you come across many different people in the psychiatrist profession. And has there been a moment when you sort of finish a day's work and you come home and, people say you don't really bring work home, but has there been a moment when you've reflected and you say, well, what am I doing? Why did I get involved in this? Because it must be a very difficult field to work in, especially with the pandemic around it.
Yes, I think as psychiatrists and doctors, we have to be resilient. So as much as we are resilient, we are still human. We still have emotions and feelings, and we do get attached to our patients, and we do get involved, and in terms of ensuring that we're doing the best for them. So I think for me, I always reflect daily. Actually, for me, I'm more on a spiritual, in terms of being a doctor and treating people, and it's about, you take that Hippocratic oath and you want to make sure that you abide to it, and you want to make sure that whatever you do for your patients is going to be the best at that time. So that's what I always do, and I trust that every day that's what I'm doing. And it's not just for my patients, it's for anyone that comes to me with help. That's how I am. So I think, yes, as psychiatrists, we're so fortunate to be in this field, or even doctors and health professionals, especially during COVID-19. These are our real heroes. They've helped people get through COVID. And even now, people that are testing positive and that are in hospital, we've seen that the healthcare professionals have been our heroes. And coincidentally, yesterday was Happy Nurses Day. So, I was so grateful for all the support that I've had, and especially working in a field like psychiatry, because I could not do, as I said, I'm resilient, but I cannot do what I do without the teams, and our nurses play such an important role. So, Happy Nurses Day to everyone yesterday. Today I'm giving the message, but we really treasure the nurses and all the COVID heroes that have helped during this pandemic, because without them, I don't think any of us can do our jobs.
Absolutely. Doctor, I'm going to hold you there. I'm going to take a little short break, and we'll be back on the other side to find out how people can get hold of you and your books and your inspirational cooking. Just give us a moment or two. We'll be back after these short words.
Sure, thank you.
How you doing, Doctor? You good?
No, I'm great, thank you.
It's wonderful. I'm getting good feedback here. A lot of people are calling the text message, loving how you're expressing yourself. Lenny, tell us the contact. Right. Can I give you 5 more minutes after this ad break, and you can just conclude and maybe tell people how they can follow you on your WhatsApp,
yes,
on your Facebook and such. Is that okay?
Yes, fantastic. Thank you.
Is there anything else you wanted to share in the next segment, or?
Yeah, so we can just talk, maybe just end off, maybe just about the COVID, anything about COVID related, and then,
sure.
Yeah, thanks.
Okay, so after the break, I'll give you 10 minutes, and then you can conclude and tell people how they can get hold of, follow you, and so on, and get your books as well. Okay, my dear?
Fantastic, thank you.
Pleasure. Just give me 2 seconds. I'll get back to you.
Thanks.
Don't hang up, just stay there.
Thanks.
For more information, check out our website. Go to www.production64.com. That's www.production64.com.
Luton Urban Radio.
Yes, indeed. Welcome back. Of course, I'm still joining us on the line. I've got Dr. Seshni Moodliar. Doctor, can you hear us?
Yes, I can, Lenny. Thank you
Now,
for that
do
break.
I pronounce your name clear, and how do you pronounce it? Because I'm getting it which Lenny's pronounce the name properly. Please, if you can tell me, Doctor, how do I pronounce your surname?
Seshni, that's fine, Lenny. That was perfect.
Seshni, love that. And what is the meaning of that word, Seshni?
So it's to do with consciousness and time. So, yeah.
Because I wanted to ask you that when I heard the other side earlier on before the break, we're talking in order to get through to with your work and the kind of patients you see, spiritually is a big thing in your life. So essentially it's to do with time.
Yes. Consciousness and time.
Consciousness and time. You know, when our parents gave us this name, some of us don't really understand fully, but I certainly know mine. My mom called me Leonard, and I should say, well, Leonard. She said, Leonard, you learned the hard way. Said, okay,
what is the meaning of your name, though, apart from Leonard?
To Leonard. But of course, my middle name would be one that one cannot really, apart from you to understand, as to do so, you know, is the middle name, that is the African name. But Leonard, he learns the hard way. This one, he learns the hard way. So, you know, I never do things simple. That's what my mom says anyway. Now, we're going to move on with timing, Doctor. Of course, we're talking about COVID, we're talking about the restrictions. We're talking about these time factors they're giving us. If you can, briefly, because there's a text message that people want to follow you and find out more. Can you give us sort of a brief line, really, as to where we're going with this timeline? Where is the government telling us now if you can now self-isolation? What does self-isolation mean? You know, are we in danger for people who may have COVID and they're just going to say, you know what, I've isolated, I'm back to work? How are we going to check these individuals?
Yes, so that's really a very, very good question. I think a lot of people are wondering the same thing, Lenny. I was almost going to say Leonard. So Leonard, so I think in terms of where we're going at, Boris Johnson is quite clear that, and Downing Street, that in the House of Commons, they've announced that the restrictions, the domestic restrictions, have ended. So they've scrapped it, it's being scrapped. And what they're saying is that anyone that tests positive for COVID-19 will not need to self-isolate if they do test positive, or even if they think that they have it. So even if someone has symptoms, they do not need to self-isolate. And this is now what he's saying that's going to be in effect from Thursday. So I think it's obviously going to impact a lot, as you said, people, if they do test positive, how is it going to impact on other people and in the spread of COVID? And I think this is what everyone is so wondering. We wouldn't know until it happens that this goes into effect from Thursday. So it's still early days to know, Lenny, exactly what's going to happen. But to be honest, I think where we're going with this is, and I had this conversation with my husband earlier on, and he was even saying that, even he will still continue to wear masks. And I think that's the same thing for me and for a lot of people I know. At work, we will still be made compulsory that we need to wear masks. So I think a lot of people will still adhere to some of the guidance and restrictions which has already been in effect from the World Health Organization, from Dr. Tedros and his team, of wearing a mask and also hand sanitizing, social distancing, and getting yourself tested. The only thing that has changed, Lenny, is that you don't need to self-isolate if you test positive. So I think a lot of people, and I think when I spoke to Opoko Pari yesterday on Hospital Radio Bedford, and I think what he said made sense. He said a lot of people will still keep to these guidance measures, so these preventative measures, because no one wants to catch COVID. And especially now that there's a possibility that people who have COVID might be in the same social settings as us, because they would not need to self-isolate. They might be at work, they might be on the train, they might be anywhere, or in the supermarket. So I think some people might still have their own responsibility, and that's what Opoku said, that every person will have that responsibility to themselves. And I feel the same way, Lenny. I don't know what you feel, but I think we will.
I agree with what you're saying there. I was going to ask you a question towards that. From a doctor's perspective, when you have these patients, do doctors sometimes feel a little bit, I don't really know, people put the gloves on, or have you been trained mentally to say, these are patients, so therefore you've got to accept and look after them, because that must be a worrying thing, especially being a doctor with a family. Do you sometimes question the idea when people come to you, should they have a mask on? And how do you deal with that particular moment when you're with a patient?
Yes, and I think not just myself will be experiencing this. I mean, healthcare professionals, doctors around the world that are dealing with patients that have COVID or potentially have COVID. And I think we've obviously everyone has been taking precautions. So as long as you are taking the precautions and wearing a mask, social distancing, and hand sanitizer, using hand sanitizer, and conducting your interview, then there is no concern. And this is the way we have been trained. I don't think any of us envisaged that we'd be training as doctors and healthcare professionals working in the front line. And as I said earlier, these are all our COVID heroes, because without them, we would not have been able to manage in the pandemic. And I think we all have done it selflessly. And even though we have families and loved ones, I think as long as you are taking precautions, you're wearing the PPE, the protective equipment, you're wearing that and you're ensuring that you are safe and others are safe, then I don't think there's anything to worry about. And to be honest, I have worked in the front line. I have worked with COVID patients. And, we've all, a lot of our professionals have had to do it, and we've been able to do it safely thanks to the PPE and to the guidance that we've been receiving. And can I just say, Lenny, the vaccines have really helped. I think this is the other reason why the government has made the decision to scrap self-isolation, because I think the decision was because of the Omicron wave being not as serious as the SARS-CoV-2 variant and also the Delta variant. So I think the evidence and research suggests that the Omicron is there, it's more contagious, and a lot of people did get infected, but it was not as lethal and it did not cause high mortality as the others. So I think that's the one reason. And then the vaccinations, the rapid rollout of vaccine 1 and 2 and then the boosters has helped people. The evidence shows that even if people did get the vaccines and if they contracted COVID, that they did not have a serious infection. So I think this is where the journey we've gone through, and that is why the government has made the decision. But let's see what happens. I just wanted to mention that the Queen obviously tested positive for COVID-19.
All right. Yeah. Yes. Sorry, I missed that particular point. Actually, she has, but most of her family. Is it Prince Charles was positive, wasn't he?
Yes. So as it happened, the Queen tested positive on the 20th of February, and her son. So she attended the Jubilee on the 6th of February, if you remember. She had the Jubilee at Windsor, and shortly afterwards we heard that Prince Charles, as you said, tested positive on the 10th of February, and Camilla tested positive on the 14th. So that's what happened. So quite a few of the royals did test positive, and I'm not sure who else in the royal household, but the Queen, when she tested positive, she was in good spirits, and she still sent congratulatory message to the GB team that won the gold medal in Beijing.
Yes, I recall that. Indeed.
Yes, and I mean, a lot of people sent, messages of good wishes, well wishes to her, from Boris Johnson to Sadiq Khan to Prof. Keir Starmer. So many people have sent well wishes around the world. So the Queen is in good hands. She's got a physician.
Talking about messages, I know there's a couple of messages here for people wanting to find how to follow you and how they can get the book, because I did talk to one or two persons about your cooking and the books you have. Perhaps if you could just enlighten those listening as well, how they can follow you and get more information about your cooking and how your channels as well. If you can, please, Doctor.
Yes, fantastic. So yes, they can contact me on Seshni Moodliar on Facebook, on Twitter, Dr Seshni, and on Instagram, Happy Doctor's Kitchen. So I'm on any of those social media, and the website is www.happydoctorskitchen.com. So
right.
Yeah.
www.happydoctorskitchen.com.
Yes, and my book, the book that I teach psychiatrists, is on the Eastern Side course, but they can have a look on Amazon as well. So some of my books are available on the Amazon Kindle. And just before we end, I just wanted to say thank you so much for this opportunity. Just wishing the Queen well. She is having mild symptoms, and she had to cancel some of her virtual appointments today. But we know the Queen is in good hands. She's has a physician, Professor Hugh, and he's obviously taking good care of her, and whatever treatment she needs, I'm sure she'll be getting it. But we're wishing her well from our household to her, and we're wishing her a speedy recovery. And I'm sure everyone is praying that she's just graceful and she's amazing. At her age, at 95, being able to do whatever she does so gracefully and still working, it's absolutely amazing, and testing positive. And I'm sure she's grateful that she's had all 3 vaccines. So yeah, just our thoughts and prayers with the Queen, Her Majesty the Queen, and hope she gets better.
Thank you, Doctor, for sharing that with us. So if we can now bring it to a close personally, for those obviously living with COVID, is going to be the thing that is new in their lives, and a message of hope, optimistic, as we're now, I believe we're now stuck with this particular pandemic. What would be your final words to those listening? And if so, is there hope? Is there a bright light at the end of the tunnel? Please go ahead, Doctor.
Definitely. I'll just have to repeat your beautiful words. It's so well said. So there is hope. I'm very optimistic as you are, and there is definitely light at the end of the tunnel. We've all been through this. We've been through the highs and lows of the pandemic, and we've learned so many lessons about being kind, loving, caring, offering support and help to other people and being of service to others. And definitely, whatever anyone is going through, there is hope, there's recovery, there's well-being. And we've seen today is the 22nd of the 2nd, 2022. It's a very significant day, and there's been so many positive changes that are happening, and it's all for the good. And I think 2022 is going to definitely be a much better year than what 2019 and 2021. We are going to continue to live with COVID safely. We are definitely more wiser. We have more knowledge. We are going to be able to prevent it, and we're going to be able to keep ourselves safe and our loved ones safe. So wherever you are, just spread the love and not the virus. And
Thank you very much, Dr. Seshni. I love that. Yeah. Spread the love, not the virus.
Exactly, and just continue living, with the loving and the kind, and also the we've had so much of positivity that's come out of this. And even though we've gone through grief, if anyone has grief, or going through grief, we're hearing about a lot of people losing loved ones. We've heard about Jamal Edwards, and I don't know if you've heard about him in Nightbird. So quite a lot of people passing away. But you know what? Our prayers with all those people that are losing loved ones. But what we can say is that contact a mental health care professional if you need support, or an organization like Cruise has a charity organization. They offer support. Mind is also a very good mental health organization. And also the Royal College of Psychiatrists. If you want to read any information on mental health issues, the Royal College of Psychiatrists has enough information as well and resources. So thank you so much, Lenny. It's been absolutely wonderful to be able to talk to you. So amazing.
It's been a while, Doctor, and I was looking forward to this. Next time we'll have you obviously in the studio with all the precautions, of course. Mask, so on, as your husband continues to wear that. I really look forward to seeing you live next time. And as I say this, don't forget that happy cooking dinner when you're coming to see us. All right.
Definitely. You just tell me what I need to make, and I'll make a really nice spicy hot curry. And,
there you go, Doctor.
I can't remember what I made the last time. It was...
Well, it was sumptuous anyway. All I know is I took the plate home, and I should have remembered to bring it back to you, but never mind.
It was curry, and it was... I know you enjoyed it. Thank you.
The good work you're doing, and greetings to your family, Doctor, and God bless. Thank you for your time.
Thank you so much, Lenny. Lots of love to you and everyone else, and namaste.
Indeed. Well, that's how we do run it. The very fabulous Doctor. Of course, I've got to tell you, log on to the Happy Doctor's Kitchen. She's there, www.Happy Doctor's Kitchen, and just Google the lady. Fantastic. How much money she's at the time? I shouldn't be hungry, are you? Okay. Well, we're looking at the time now.